Hey everyone, welcome to today's discussion of functional medicine discussion. And today we have an important topic. Today we are talking about, guess what it is? Disease. And not just any disease, but really all diseases. And why are we talking about all diseases? We're talking about all diseases because we have epidemics on our hands today. We have health crises all over the world, especially in the United States. Now, I have a question for you. Think about what could be the top killer in the United States right now. What's the top health condition that is, causing chronic health disease and deaths? So some of you might be thinking diabetes, right? What about, could cancer be it also? Possibly. Or maybe heart disease. So yeah, any of these could really be the chronic killer in the United States, but I have an even better one. So I don't think any of these, because truly, what are these? These are diagnoses. Diabetes is a diagnosis that you get from your doctor. Cancer is a diagnosis that you get from your doctor. Heart disease, well, there's different types of heart disease, but again, this is a diagnosis that you get from your doctor. Of course, diagnoses are important. They help lend to an idea of what's the problem. But what's the actual cause of these is what we want to know, and what needs to actually be investigated further, especially today. So what is the major cause, truly? What's the major truly cause of the chronic health conditions in the United States? It's none of these. What it actually is this: inflammation. So what is inflammation? Well, maybe you've heard of inflammation. You probably have. A lot of people have heard it, especially those who have been in school, medical school. But the problem is there's two types of inflammation. So the type of inflammation that most medical doctors and medical students learn about is the inflammation such as if you stub your toe, right? If you stub your toe, it gets big, it gets swollen, right? It gets hot, it hurts, it's painful. So that's inflammation, that's acute inflammation. But what all those chronic diseases that we just talked about have in common is actually chronic silent inflammation. So this is inflammation that actually starts to decay all body systems. So inflammation is good, we need it in our body, but when it's excessive, when we have too much of it, that's when we have a problem. Now, we currently do have a problem, okay? Because there is 70% of the United States is either overweight or obese right now. That's crazy. 70% of our population is overweight or obese. So I can't even fathom that, okay? And that's just one statistic. The next one I want to give you is this, that 50 million, and yes, I did say million, 50 million Americans have an autoimmune condition. 50 million Americans with autoimmunity. So, what does this mean? What does autoimmunity mean? It means that their body's essentially attacking their own tissues. And this is a problem because this all causes inflammation, right? This big, hot word right here that many people have heard about, and it's really at the underlying cause of almost all chronic health conditions, whether it is the true cause or the result of health conditions as well. So these are shocking statistics, and this needs to start to reverse itself, and that's what we're going to talk about today. So because of these topics, and I'll leave this up here actually, inflammation, okay, what we want to talk about is, where does inflammation come from though, right? So yeah, inflammation, you can get inflammation, then you get these conditions, but where does it come from? So, we have stress, right? Everybody has stress. I'm sure you're watching this, you could be stressed out right now. Everybody gets a lot of stress, especially in our day and age. And so, it's not that stress, we want to avoid stress. Stress is everywhere, you can't avoid it completely, but there's certain things we can do to lower the stress. But really, truly, where does stress come from is the question. So, and that's what we rate back to inflammation. So stress, well, you have different types of stress, right? You have physical stress, you have emotional stress, and you can even have chemical stress. So what does this mean? Physical stress, emotional stress, chemical stress. Well, physical stress, think about it like this. If you were running a marathon, if you're training for a marathon, if you're cutting weight for a competition, or even if you're just doing too many CrossFit workouts and you're extremely tired, you're extremely stressed out physically, this causes inflammation. Now your body is going to tell you, hey, I'm tired, I'm sore, I'm fatigued, my legs hurt, my arms hurt, my body hurts, I need a break. And that is your body producing inflammation, telling you to relax, right? It's telling you to relax. Emotional stress, right? Where can the emotional stress come from? Everywhere, right? Your relationships at home, whether it's with a spouse, whether your kids are driving you nuts one day, whether it's at work with a coworker or a boss, emotional stress, or whether it could be from the loss of a loved one even. All these things can play emotional stress. And what does emotional stress do? Well, it makes us feel down, right? We can get sad, depressed, tired, fatigued from emotional stress as well, right? So emotional stress sometimes can be one of the biggest stressors out there because it is on our minds as well, right? So emotional stress. And what happens with emotional stress? These things happen. You start feeling sad, depressed, down. And so what is, you feel like I need to take a break, right? So maybe you don't go into work for a couple days. Maybe say, hey, give the kids to the babysitter for a weekend or whatever it might be, right? You take a break. Chemical stress is also another big player. And this is one of the biggest players in these chronic disease states that we're talking about. Cancer, diabetes, heart disease, autoimmune conditions, all of these chronic health conditions. Chemical stress is a major player as well. Where does chemical stress come from though? Chemical stress comes from things like our food, our water, our environment, the plastics that we consume, the metals that we consume, all of these things in our environment, right? So chemical stress is huge. Now, and what happens with chemical stress, right, is if you continue to eat a food that you're sensitive to, or you continue to breathe something that's not good for you, or you continue to drink something that's not good for you, maybe you drink too much alcohol, whatever it might be, your body's going to give you signs and symptoms, right? And it's going to tell you, hey, you're having a lot of inflammation. Calm it down. Don't eat this food. Maybe you're getting fatigue, gas, bloating, constipation, diarrhea, skin rashes, chronic pain, joint pain, whatever it might be from a chemical perspective. So your body gives you these signs, right? And so the problem is that we are not listening to these signs, right? So what happens? If you don't listen to the physical signs, right? You're working out too much, your body's sore, fatigued, tired, you know, your body's like, I need you to take a day off. But, you know, if you're a high school athlete and your coach is like, no, I need you on the field today, and well, what can happen? Well, if you don't heed the signs of physical inflammation and stress, what can happen? Well, you can get hurt. You're more prone to injury. You're more prone to not doing very well. You know, your performance will go down. So important. Emotional stress. If you don't listen to emotional stress and inflammation, what can happen with this? Well, say you're having a hard time at work with a coworker or a boss, and you go to work the next day and you blow your steam and you get in a big argument and you get fired or something bad happens. Well, you just lost the emotional stress hit its threshold there. So you didn't follow the emotional stress guidelines as well, right? What about chemical stress, right? We keep eating these foods that we're sensitive to. We keep drinking whatever it is. We're inhaling whatever it might be in our environment. We're continuing to do these things that are causing health conditions, right? And so what happens is now you get signs and symptoms, and then you get these things called diagnosis, which we talked about earlier: heart disease, cancer, diabetes, autoimmune conditions, lupus, multiple sclerosis, rheumatoid arthritis, Sjogren's, psoriasis, eczema, whatever it might be. There's over 100 different autoimmune conditions nowadays, right? It's a big bell right there. So this stuff is on the rise, and this is why we really need to keep in mind that we need to heed this information, right? So what do we do? So we have these types of stress. So what can we do about this is the question, right? Well, you know, hey, the physical stress, the emotional stress, chemical stress, there's certain things that we can do, right? So and this is why we want to talk today about this topic. So what can you do from a physical aspect, an emotional aspect, and a chemical aspect to reduce inflammation? From a physical aspect, what can you do? You can do things like stretching, yoga, things that stimulate your parasympathetic or your rest and digest so that your body produces more growth factors so that you can actually heal the body and calm it down. Emotional stress, what can you do? Same types of things. Nice deep breaths, things that will calm the body, all right? We are talking about the autonomic nervous system in this video, but this is all related. So we want to calm the body system down. So emotional stress, breathing, yoga, going on daily walks, getting out in nature. All of these things have been shown to reduce stress, right? It's a good thing. Chemical stress. How do we reduce chemical stress? Well, we need to first assess where the stress is coming from, right? Emotional stress and physical stress can sometimes be easier to identify. You know, if you're working out too much, well, it's pretty apparent that, you know, you're having physical stress due to the exercise. If you are having a hard time with spouse or at work or with children or a friend, a family member, whoever it might be, an emotional relationship, you know, you can probably identify pretty easily. The harder part is with chemical stress. We are now, you know, we have more things that are bombarding our immune system on a daily basis. we have more chemicals in our food now. I'm sure everybody's aware of this. We have what's known as genetically modified organisms that are abundant in nearly all the foods we eat. So, it's very hard to get away from some of these chemical stressors. And so this can be the hardest one to truly identify on your own, essentially. So chemical stresses, we need to identify them. So what do? Well, there's a lot of things we can do to identify chemical stresses. We can do specific diets, elimination diets, whatever it might be. But really the easiest ones that we apply in our clinic is things like food sensitivities. If we're reacting to foods, this is a major stress on the body. This causes a lot of inflammation. All these chronic health conditions are characterized by poor diets. Cancer, right? Diabetes, okay? Heart disease, autoimmune conditions. What do all these things have in common? Well, a lot of them start in the gut. So if we have a poor gut function, it's gonna really affect the entire body. So that's the number one thing we gotta look at is chemical stresses, because again, these can be some of the hardest things to really identify on your own. So we do things like food sensitivity testing, stool testing, organic acid testing. We do comprehensive guidelines so that we can actually accurately assess what is causing the stress. We actually look for inflammation markers in the body, but then by further narrowing down the testing, we're able to identify where the actual stress is coming from. And then once we eliminate it, then we can put people on their path to better health. So that is what we do. We essentially identify all these things. And because, we're having these epidemics, autoimmune conditions, ADHD, ADD disorders, all these things are on the rise. My grandparents are in their 90s now, and, our life expectancy is actually going down. And so it should be a huge red flag, a huge indicator for all of us that we need to start changing these things. And we need to start looking at our own diets and our own lives and start really assessing these things and just really looking at the big picture on how we can reduce inflammation in the body. So this is the major thing that we always want to reduce, because again, there's two types of inflammation: the type where you stub your toe and the type that doesn't tell you that it's starting to occur. And so it can take years and years and years before you actually get symptoms from the inflammation. And then once you get symptoms, then you might get a diagnosis, maybe, sometimes. So I hope this video helped you today. Please share this video, please share this information. My mission here is to help as many people as I can. I wanna help 100 million people. And so if this information helped you out, if you think it'll help someone else someone you love, please share it with them. Like the video, share it. Thanks for watching, and have a great day.